So what is the purpose of PRP? Why would you go get it? Why would you go get steroid injections? What are you looking for as a patient? The easiest answer is you've injured yourself. You've had a disc herniation. You've did an injury to your rotator cuff. You've sprained your knee. You've done an injury that's significant enough that the body's not fully healing itself. And so what PRP does is the body goes through an initial healing phase. That healing phase takes about 30 to 40 days for the body to go clear through that healing phase. Once it hits that end of those 40 days, it shifts gears and it goes from healing to accommodating. So it goes from taking and making it so the wound's gonna go away to scarring or to decrease function so that you don't push into that pain point anymore. The thing that PRP does is it reinitiates that healing process that you go through those first 30 days. So it takes and it draws that tissue closer together so the wound heals better. It softens the scar a little bit. It allows the body to get a longer healing process and not shift into that accommodation stage. One of the things that everybody compares PRP to is corticosteroid injections. You go in, they're going to inject a steroid around the joint or into the joint that manages pain. It helps increase functionality. The challenge you have with corticosteroids is it causes a degradation or a destruction of the tissue around it. So it speeds up all of those wonderful things that nobody likes to talk about, like arthritis. It causes some of those longer term things if you get them repetitively, where PRP doesn't. It gets similar, if not the exact same results, but it causes healing and prolonged regeneration instead of degeneration. How you go through and how we do PRP. We're gonna bring you in, we're gonna do an exam to make sure that you qualify or that you're a candidate for PRP. If there's a disc injury, we wanna make sure that we're going to go into the proper area, so we're gonna look at doing an MRI. We're gonna make sure that we're diagnosing the issue properly. We're gonna take that blood, we're gonna put it in a centrifuge and we're gonna spin it down so that all the red blood cells settle to the bottom and the plasma comes to the top and the platelets sit right in the middle. And we're gonna go in, we're gonna take a needle and we're gonna draw that middle part out to get as many platelets as possible. That's where PRP comes from. So it's literally taking part of you and giving it back to increase your healing. Steroids, you can only do so much because again, it causes that degradation of that tissue. PRP, you can take and you can do a round of 3 in 6 months, every 6 months, indefinitely. So you can re-kick off that healing process as much as you need to get the recovery that you're kind of looking for. Now, given if you've got a full rotator cuff tear, it's completely blown out, you're not slowing down, is it ever gonna really heal? It's not. You have to go through, you have to take care of the shoulder, you have to rehab it properly. This is a part of the healing process. The difference between PRP and stem cells, PRP initiates the body's own response to healing, where stem cells go in and they can change, statistically what they do is they change into any tissue type. So if I have a tear in the rotator cuff, I go back to the rotator cuff because it's really easy. Everybody knows what a torn rotator cuff is. If you have a tear in the rotator cuff, the stem cells will change into ligaments or bone or muscle, whatever's needed or whatever it deems is necessary. The stem cells will actually shift into and become those types of cells. Where the PRP doesn't do that, it causes the injury, the tear, to reduce in size and it clots and it causes the natural healing process to reinitiate, trying to heal that wound again. One of the things about PRP is that it's been FDA approved for over a decade, where on the opposite hand, corticosteroids hasn't. So looking to be one of the best practices in the area, we've actually brought in a phlebotomist that does all of the blood draws for us. So for us to do PRP, we stand out a little bit for that reason alone. We have a professional that's been trained, that's licensed to come in, draw your blood, spin it down in the lab, provide that for the doctor to do the injections.
When we draw blood, there is a very long 30-step process that takes all of about a minute. It all starts with cleaning the area. We want to make sure that the risk of infection is about as low as you can get. So it all starts with cleaning, and then you have to find those lovely veins. Once you find the vein, you draw the blood and you put it in this thing, and it's called a centrifuge, and it basically just spins the blood really, really, really fast and separates it from the red blood cells and the plasma. And then you have to let it sit for a couple minutes so that the platelets can settle at the bottom of the plasma, because when you separate red blood cells from plasma, they create this thing called a buffy layer. Red blood cells are much heavier than plasma, and so the buffy layer is where all of those platelets sit. Then once we have spun the blood down and let it rest for a minute, we will take the plasma out of it with all of those lovely platelets in it, and we will inject it back into you where you are hurting, whether it's your knee, your wrist, your back. Platelets are great. They reinitiate that healing process.
So let's get you into reflex today so that we can get you back to play tomorrow.